mode of contraception does have a failure rate. So, the IUD is one of the lowest ones. It's almost as successful in stopping pregnancy as having sterilization done. So, each one with the correct use has its failure rate.
Awesome. Thank you. Okay, so what are some of the symptoms or signs that that are associated with infertility?
A lot of people won't know that they have infertility. Some people, for instance, women with PCOS, they are usually the ones who know that they are going to have some sort of trouble trying to get pregnant because they know that they don't have periods regularly for some of them. So those women may know that they need to seek advice when they are wanting to get pregnant. And a lot of them would have been told by their GYNs already that they should seek advice when they want to get pregnant. But a lot of women do not know that they suffer from infertility until they actually try and get pregnant. So, as I say, under the age of 35, trying for 1 year, or over the age of 35, trying for 6 months with regular intercourse, then you should seek advice if you're not pregnant within that time frame.
Thank you. That's really interesting. I think a lot of the blame or the onus on pregnancy is on women, whether
Yes.
or not we conceive, and the conversation rarely is geared toward if men are infertile, and if that. Is that something that comes up in your practice as well, where men are coming in and asking questions about their reproductive health? And if so, can you tell us a little bit more about male infertility and testing, the kinds of testing that men can get and how soon they can get tested?
Yeah, so it's very rare that men think it's them. It's usually the fact that the woman will come in, we usually do the workup on the woman, and then the men grudgingly comes in to do a semen analysis, and that's usually the test that we will run initially on the men. It's just looking at the counts of the sperm and looking at the movement of the sperm, and then also looking at the actual body of the sperm if it looks normal. So a lot of my patients will actually say that their partners don't think that it's them. They have a child already, so they know that they're fertile, or they don't have any issues in terms of erection, ejaculation, that sort of thing. So, it is sometimes very difficult to get the men involved, but we actually find that up to 20% of infertility is male factor infertility. So it is, either because the counts are low or the movement of the sperm is abnormal.
Yeah, I think that's something that one of the reasons why we're having this conversation is because it's just so important to think of this in a holistic sense, and not so much, if at all, on a blame game. It's about just understanding our bodies and educating ourselves, and just making sure that we're keeping ourselves and others informed. We need to just make it more of a normal thing to do, and not this difficult weight of the world on our shoulders kind of conversation.
Yes, absolutely. And men typically don't go and see a doctor unless they're sick. So and they really have to be really sick for them to go and see somebody. So a lot of times they don't actually know that something's wrong with them. And the initial test that we do with the semen analysis, if there's an abnormality, we then dig a little deeper. And sometimes we find that the partner is diabetic, or has an issue with their thyroid, or we find other medical problems associated with that. And the first test that we would have done on them would be a semen analysis. Wow. And that discovered it.
And it sounds like it has a lot to do with time. The sooner you go, the faster you're able to figure out what's going on and then get help, or figure out alternatives. So timing seems like seems to be a really big part of all of this, when we're talking about just overall health and wellness. Okay.
Yeah, which is why it's important to have the annual exams with your doctor, so that they know, and you can talk to them about what your fertility, with any fertility questions, or what your fertility desires are, and they can then keep you on the right track in terms of, if by a year you've been trying under the age of 35 and nothing's happened, then they can refer you in a timely fashion.
Thank you.
Yeah, I sometimes have patients who come and tell me they've been trying for 5 or 10 years, and it's unbelievable. Some of the stories that I hear.
And what are some of the challenges you have experienced in your practice in terms of just like patient experiences, or just like fact checking information, patients coming in saying like, my so and so told me that, and their information is more valid than yours. Can you tell us about that?
Yeah, I think the hardest thing is with how much people search online and believe what they read online, um, more than what they'll believe a doctor will tell them. And it's sort of difficult to then shift through that and pull out the truths, and then also explain that, yes, the person who wrote whatever you read may have a diagnosis that is completely different from what you were diagnosed with, and try and explain to them why treatment for them would be different from what the treatment that I'm offering them would be. So I find that Dr. Google sometimes is not a very good doctor.
Yes. Sometimes I rely on Dr. Google too much, and I have to remind myself that this is some information is good, but a lot of it is just other people putting information online. So we have to vet information, especially when it comes to something so serious like fertility, or what's going
Yeah.
on in our bodies. You have to be more cautious.
Right. I mean, I do encourage people to research, but research, on legitimate websites, and, so because it can be then very difficult to figure out what is truth and what isn't.
Had a lot of women ask about vaginal health,
Mhm.
um, and how that may affect, if at all, if it affects fertility, and just how can we keep ourselves healthy with foods, and also pH balance and all of that. Can you talk to us a little bit about what are some of the ways we can keep um, vaginal health and balance?
Yeah, so I know a lot of women use a lot of beauty products that are advertised, and some of them are okay, some of them aren't. I always recommend that don't use anything internally, because the pH of the vaginas, it can get affected by just a very slight change by using any sort of soaps or solutions or anything like that. And you can find that if you do douche or use anything like that, or use any solutions to clean the vagina or anything, you can find that you might suffer from yeast infections, you might suffer from urinary tract infections, that sort of thing. So I always say just stay away from anything more than just water. And some people feel that um, using sort of yogurts and things like that may help as well. And I always say no, stay away from things like that too.
Yeah, I've heard that too.
Diet. Sorry.
No, I've heard that too. Yogurts, and also taking baths and using like soaps in the water, or like highly fragranted scents and lotions and stuff like that.
Baths with things in the water are fine, but then when you start to actually, some people will actually try and wash out the vagina itself. I say stay away from that. Just external washing is fine.
There's so much we don't know about our bodies and that we see, and I think media has a lot to do with it. Growing up and watching movies,
Yeah,
you see the beautiful woman about to go out and she sprays like the inside of her thighs with perfume. And so, growing up, you may take your Victoria's Secret or whatever spray you use and spray all over. And
yeah.
sometimes that may change like your scent, or that may
Mhm.
give you burning or whatever sensations and things of that nature. So
That,
that's good to know.
yeah, absolutely. The skin is very sensitive, and then also, as I say, changing just the pH just slightly can cause infections in the vagina.
Can foods change the pH balance, or the environment of the vagina
Yeah,
itself?
typically not any foods. They don't really change the pH or the environment of the vagina. Um, for some women who suffer from recurrent urinary tract infections, cranberry juice or some acidic juices can actually help with killing the bacteria in the urine. But otherwise, in terms of vaginal health, just having a regular diet, lots of fruits and vegetables, low carb diet, low fat diet, that sort of thing.
And keeping in that same direction, what are some of the causes of excessive vaginal dryness, and what can women do to address this issue? I know that that's something that in the chat came up a lot.
It could be a number of reasons why that's happening, and it really depends on the age of the woman as well. So it's quite difficult to sort of generalize in terms of what might be the cause of that. But I would recommend that, speaking to your OBGYN would be the first step, especially if somebody is experiencing vaginal dryness, because there could be a number of reasons why that's happening. But there are a lot of products that are advertised for that. And if it's specifically during intercourse, there are some products, gels in particular. Some people use oils and things like that. I always say that you should stay away from any oil-based gels or lubricants. Try and use water-based ones because they won't likely change the pH of the vagina, as we've been discussing with yeast infections and things like that.
I do want to talk about COVID, of course, because this is part of the reason why I would have loved to do this like in a more open forum, open setting. But given the realities of COVID and just where we are right now, I wanted to talk more about the impact of COVID on pregnant women, and how has COVID, impacted pregnant women expecting or who are trying to receive. How has it impacted their fertility treatments or access to care, etc.?
Yeah, I feel that it definitely has affected women's access to care. Some women are not actually seeking care because they're worried about, being exposed to COVID. A lot of fertility specialists are doing telehealth, or telemedicine consultations. So that's one way to access care. In particular, it is a little difficult for your annual exam and things like that to go to your GYN because you actually physically have to go into the office to be examined. But you can always reach your doctor and ask them questions about trying to conceive. In this time, a lot of the hospitals have been very careful in terms of protecting pregnant women, making sure that they have safe deliveries, making sure that the babies are safe when they go home. So we are trying to keep women conceiving, women who are pregnant, and women who have delivered as safe as possible in this time.
One of the things that I would like to jump into really quickly, I know we talked about, and this is, we met before this, and we talked about insurance and how insurance may play a factor into fertility treatment for women or families who are trying to conceive, and the impacts of COVID on that. Can you tell us a little bit more about that?
Yeah, I have a few patients who were furloughed or fired. So quite a few of them are actually trying to get a lot of their fertility treatments done now before they lose their insurance. So it is quite sad to hear the stories of my patients who are going through this, and we're trying to get them pregnant as soon as possible before they actually lose their coverage. Some insurance companies do cover fertility testing, some will cover fertility treatments. It all depends on the insurance company. But as of 2020, the state of New York now has a mandate that if your company has more than 100 employees and meets certain requirements, that the insurance companies will cover fertility testing and fertility treatments.
That's awesome. And is that for both men and women, or gender, is that gender inclusive, that mandate?
So, it is to some respect. Unfortunately, for women in same-sex couples, there are some caveats to that, because the diagnosis of infertility, as I say, is under the age of 35 trying to conceive with regular intercourse for 1 year. So women in same-sex relationships, unfortunately, have not been trying to, most often have not been trying to conceive unless they have a known donor and are doing inseminations at home, haven't been trying to conceive for a year. So the insurance companies sometimes will not cover inseminations. Insurance companies do not cover purchasing sperm from donor agencies. So we are finding that quite difficult.
Conversation, menstruation. Yes. So, and we had this conversation offline, but I was just blown away as we talked about the length of how long the menstruation cycle should be, ovulation. So I want to get into a little bit of that. Can you tell us how long is a menstrual cycle, ovulation, and when should you be trying to conceive, in what time frame or period?
Yeah, so a menstrual cycle can range. Every woman is a little bit different. Some women, their menstrual cycle is anywhere from 21 days, while other women, it can be up to 30, 32 days. That's on average, anywhere from 21 to 32, 35 days. Anything above 35 days is a little bit on the longer side. And that goes in keeping with women who have polycystic ovarian syndrome. And within the menstrual cycle, the actual period itself, which women also often call their cycle, can range anywhere from 2 to 3 days to 7 days. And that's on average.
Okay, so
typically when you hear somebody who has a 28-day period, only around about 25% of women actually have a 28-day period, a 28-day cycle.
And cycle means that they are bleeding throughout that time. I don't know if that's too graphic, guys. I'm just gonna say bleeding.
Yeah. So when I say cycle, I mean from the first day of one period to the first day of the other period, of the next period.
Got it. So that time in between
cycle.
Is the menstrual right. So your menstrual cycle is not 4 days technically. That's the length of the time between the date started and the date
period. The period or the menstruation can be is the first day of bleeding to the end of the bleeding.
Got it.
Right.
And how does this impact ovulation? And if you know a person is trying, when should they be trying? If they're trying without naturally, what time frame should they be looking at?
So if you have, let's say you have a 28-day cycle, then you usually ovulate halfway through that 28-day cycle. So you would usually ovulate on cycle day 14. So that's around the time where you should really be trying. And I usually say have intercourse every other day and make sure you hit that 14-day mark as well when you're having intercourse. And then over that, just in case you ovulate a little later. The first part of the cycle, which includes your period, usually is variable in length. And that's what actually gives the length for the menstrual cycle. The last 2 weeks of your menstrual cycle is always fixed. It's always 2 weeks. It's the part before that, before you've actually ovulated, which is variable.
I'm so excited because I never knew that. When we had the conversation, that's when I found that out. So I'm just like so excited to have this information now to share with other people. I hope that they are as blown away as I am, but also feel prepared to share it. And lastly, I think we talked about different types of birth control, but I also want to talk about the financial aspect of that, because I do know that there are some, like you mentioned, the IUDs and other forms of birth control. Do you know if those are covered by insurance? And can you tell us more about
that? Some of them are covered by insurance. It all depends on what your insurance coverage is. Majority of insurances will cover birth control. And they will cover majority of the forms of the birth control.
I'm sorry, I don't know if can you hear drums?
Yeah, I think a process is Going across, yeah. Sorry.
Okay, no worries. Well, I
I
hope
wasn't too loud.
no. I'm like, goodness, that's what I feared, but it's okay. It's a good beat. All right, before we open up the floor to questions, I did want to read an excerpt from the National Partnership for Women and Families. Black women are 3 to 4 times more likely to experience pregnancy-related death than white women. This spans across income and education level. And I do want to talk about that just a little bit more because the pregnancy related deaths you see more and more in the media of young Black women dying, whether it be through natural delivery or C-section, who are seemingly healthy, but they didn't make it home with their babies. And I just wanted to highlight that and talk just a little bit more about that.
Yeah, it is one of the things that we face, that as Black women, we are at higher risk pregnancies. We are at higher risk of preeclampsia, which is high blood pressure in pregnancy that can put both the mother and the baby at risk. We're also at risk of having higher chance of having a C-section in pregnancy. And then unfortunately, maternal deaths are much higher in women of color.
It's very unfortunate to see the disparities, and most notably, I think Beyonce and Serena were, two women who've spoken out, talking about their pregnancy experiences. And in my mind, I thought this was a poor issue, or this only happens in certain communities where women have to literally beg for their doctors to listen to them, or their health professionals to care for them in their unborn child in the way that they may care for their white counterpart. And so I was shocked because I'm thinking, well, this is Beyonce. How could she, have this close or near death experience, right? How could she have all of this money and all of this access and still have to go through what she went through? And Serena Williams, I don't know if you saw her HBO documentary where she actually talked about her experience, where she told doctors that she wasn't feeling well, and in the end it was found that she had a pulmonary embolism. And so this is something that she voiced at the time, but her doctors didn't take heed to what she was saying. And so I think a lot of times when we are talking about pain and we're talking about how we're feeling, sometimes our doctors aren't listening. But I think that it's so important that we continue to have these conversations so that we know how to better advocate for ourselves and on the behalf of other people who are not able to. I also wanted to say, it's so important, and you brought this up, that we learn our rights and what we have access to. And thank you for sharing that information about the health insurance and their policies around that, because I think a lot of it is just miseducation or not being informed. And because of that, we don't ask certain questions because we don't know what we're entitled to.
Yes.
And I do want to touch on just a little bit more about what are some of the questions that women and men should be asking their doctors in terms of when we're thinking about trying to plan a family or insurance related questions. How can we start to have these conversations with our doctors and healthcare professionals?
Sure, certainly. I think for men in particular, the one thing is to make sure that they have an annual exam with their doctor, even if it's not an annual exam, maybe every few years, doing a semen analysis just to make sure there's no initial issues with the sperm counts, with the motility of the sperm. And then in terms of women, just making sure that they are also healthy before pregnancy, taking a prenatal vitamin, for instance, at least 3 months before you try and get pregnant. You can get that on prescription, or you can just buy it in any of the pharmacies, because it contains folic acid, and that's really vital in the early parts of pregnancy. So a lot of women are not actually taking prenatal vitamins when they get pregnant. So it's just general things like that your doctor can be the first point of call to discuss these things with you.
Thank you. Yeah, that's really good to know. Even though prenatal vitamins have pre in front of them, I thought you take prenatal vitamins while you're pregnant, but you take them
Yeah,
before to prepare.
exactly. Exactly, because not everybody has a good diet. So at least the prenatal vitamin not only contains folic acid, it contains a lot of other vitamins that your body might be missing.
Awesome, thank you. In order to have a better healthcare system for women, specifically Black women, we need to address the many system inequalities that we, have from um, just not receiving fair or equal treatment. So whether that be from, doctors or staff, or just like receiving or family not having the proper support. What would you say is the best way for a person who doesn't necessarily have the support if they're trying to conceive, or what should be some of the steps that they go and try to take so that they have a healthy pregnancy and post pregnancy?
I think it's definitely um, women should definitely try and advocate for themselves and their partners to advocate for them as well. If you're having issues with the doctor that you have, there are so many doctors out there, and you can just find another doctor. It is difficult during pregnancy to switch doctors, but it's a matter of advocating for yourself, making sure that you're comfortable with whoever's going to be taking care of you and delivering your baby.
What effects can long psych meds have on fertility, if any? The doctor said she's fine, but they have been trying for 5 years.
What effect, sorry, could you repeat the beginning of the question?
Sure. What effects can long-term psych meds have on fertility?
So some medications can actually affect the way that estrogen, which is one of the main hormones produced by the ovaries, it can affect that the way that that is metabolized by the liver. So you should definitely seek your medical advice and speak with an obstetrician or gynecologist or a fertility specialist in particular, because you have been trying for 5 years. I would definitely recommend that.
Thank you. The next question is, I was told a few years ago, although I am 35 and still in a childbearing age, my doctor said because of high blood pressure and previous C-sections, my OBGYN said she didn't feel comfortable with me wanting aid to have another child. She said my best solution is a long-term IUD.
That is true. The recommendation is to have up to 2 C-sections. Once you have more C-sections than that, there is the risk of um, scar tissue during when encountering scar tissue when you do more C-sections than 2 C-sections, and it can put the mother's life at risk and the baby's life at risk. The other issue as well is the high blood pressure, which also can put the mother's life at risk, and the baby's life at risk. If you already have baseline high blood pressure, you can be at risk of preeclampsia and pregnancy as well. Sometimes, if you're able to control your blood pressure prior to getting pregnant, then pregnancy can be an option, but it all depends on how well controlled it is prior to pregnancy.
Thank you.
Yeah, and I always say, if you're not happy with the information or the advice that you're getting from your doctor, you should seek a second opinion from another doctor.
Another viewer, thank you for the questions, you all. Okay, another viewer is asking, I heard that freezing an embryo is better than freezing an egg. Is that true? Also, what is the oldest you have seen this done?
The oldest I've seen what?
It's done. So the freezing of an embryo egg, I guess.
So yes, usually over 95% of embryos will survive the thaw of being thawed to get implanted, and about 90% of eggs survive being thawed. So it all depends on your age as well. Under the age of 38 is the best time to freeze eggs. If you're over the age of 38, we don't recommend it. We usually recommend freezing embryos if you have a partner. And The oldest I've seen of somebody freezing eggs is about 41, 42. Above that, we don't tend to, because by 40, half of the eggs are going to be genetically abnormal. So we don't tend to want to freeze eggs at that point. We would rather freeze embryos, because if there's anything, if usually the eggs fertilize, then they form embryos. And then as the embryos grow, the genetically abnormal embryos sometimes will not continue to grow, and they sort of get selected out in that way.
See.
So the oldest that I've seen embryos frozen is about 46. But usually those are embryos that have had genetic testing done on them, and we know that they're genetically normal or abnormal. Yeah.
Thank you.
The women are born with all of their eggs. It's not like men who are continuously making sperm. So there is, as we were saying, a timeline on those eggs.
Okay, so I met a couple that spent $150,000 to $200,000 to get pregnant, but they still could not conceive. Is that common? They actually ended up adopting because they said they could not bear going through that again.
Yeah, especially for couples that insurance doesn't cover any fertility treatments. Some people do spend in excess of that trying to do IVF cycle after IVF cycle, unfortunately, yes.
And I think you mentioned before that depending on your insurance, if your insurance has over 100 employees, there may be some support with that, with the financial part of that.
Yes, sometimes they will cover the testing involved to try and figure out why you're not able to get pregnant. And then sometimes they will cover actual treatments, whether it be inseminations or actual IVF.
Gotcha. Okay. Sorry, hugging my computer. Okay, the next question we have, another viewer is asking thoughts of using a doula or midwife for pregnancy. This is common. I've seen a lot more women taking advantage of doulas and midwives. Any thoughts on that?
So I'm from the UK. I trained in the UK as an obstetrician and gynecologist. So I'm actually board certified there as well. And a lot of pregnancies are delivered by midwives out there. Yes, so I am a big advocate for midwives. I think the midwives are great. Doulas are not actually medically trained. They give great support during pregnancy and during the delivery, but I find that in women where they have had deliveries with doulas, sometimes they can interfere with the medical advice they're receiving. So I would just, have a cautionary note that yes, it's great if everything is going absolutely normally, and there's no issues in terms of the pregnancy or the delivery. Midwives and doulas are great. But if anything starts to not be normal, then, having an obstetrician and gynecologist involved is vital.
And do the midwives, so midwives are board certified and medically trained?
Midwives are medically trained. Majority of midwives are nurses, and they have additional training to become midwives, and then they're able to do deliveries, yes. Most midwives will deliver in a birthing center, or they will deliver in a hospital. Some midwives do home deliveries as well.
Awesome. Yeah, I've seen a couple of celebrities that have come out and saying that they're doulas, and so it's I think sometimes when we see our favorite stars in this field, some people are like, oh, I want so and so to help me deliver my baby, and they might not necessarily have the certifications or the medical knowledge associated.
No, not necessarily. Doulas don't tend to have medical training, no. Okay. It's more of a support role.
So emotional support.
Emotional support, yes, absolutely. Okay. And then they also help after the delivery as well, in terms of caring for the baby and things like that.
I see. Mm-hmm. And where can we learn more about your practice?
My practice in as in reproductive endocrinologists, or where I work now?
Well, all of that. I think folks are trying to contact you. Maybe that's what it is.
Okay, so the American Society for Reproductive Medicine essentially is where our guidelines come from. So you can learn more about reproductive endocrinologists and infertility from that website. It's called ASRM for short. And I work at Genesis Reproductive Medicine, which is in Brooklyn.
Okay.
ASRM, M for mother, ASRM.
Is there anything that we touched on that you want to add on to, or any of the mentions?
One thing that we had spoken about that we haven't touched on yet is when people are trying to get pregnant, things that they should use in addition to prenatal vitamins. Some people may consider using ovulation testing. So the way that ovulation testing works is that it tests a hormone that the brain releases, and it tests that hormone as it's being washed out in the urine. So there are all sorts of different tests that you can buy online or in pharmacies, you know, various brands. I don't want to mention any in particular, but there's various brands that you can buy. And you know, I think using those is a very good way of seeing when you're actually ovulating, so that you can actually time intercourse in time with when you're ovulating. So you use the test first thing in the morning. It's kind of like a pregnancy test where you pee on the stick first thing in the morning. The reason it's first thing in the morning is because the urine is most concentrated at that time. So you pee on the stick, it tells you yes or no you're ovulating, and then you do it every morning. And this is after you've had your period, because that's the time when you're actually going to be ovulating, after that time. And then once it turns positive, know that you have to have sex that day and then 2 days later. So that hormone gets released to actually tell the ovary to ovulate. The ovary doesn't respond for about 24 to 48 hours. And then the egg is receptive for about 24 hours for fertilization. So that's why we say have intercourse every other day, and even after that time of when the ovulation tests turn positive. Because we don't know if you ovulate 12 hours later or 48 hours later. We don't know where you lie in between that.